Good afternoon, everyone. My name is Nicole Epps, and I am the Managing Director of the World Childhood Foundation USA, and we are honored to co-chair this workshop together with Mount Sinai. At the World Childhood Foundation, we believe in the 2 Ps to end violence against children and adolescents. Those 2 Ps are prevention and partnerships. We believe that prevention and raising global awareness for all adults and children are important to have their voices heard and to teach all of us to be child protectors. We also believe in the power of partnership because it's only with our partnerships in the private sector, with other organizations, non-governmental organizations, academics, and medical institutions that we believe that we can impact real, tangible change. For example, together in partnership with Erickson and Darkness to Light, we launched the Stewards of Prevention Toolkit mobile application, which you can actually find on your app store. And it provides training for all adults to not only identify, but also to handle responsibly any disclosures of child sexual abuse. We believe that that is one step on the roadmap that we're working on today. In our panel today, Data and the Societal Cost of Abuse, we will talk about the importance of investments in research and programs to better address the issue of violence against children. Our experts, Suna Hanoz, who is the International Programs Director of ACV, Mother's Child Education's Foundation, Meg Gardinier, who's the Secretary General of the Child Fund Alliance, and Katie Albright, who is the Executive Director of Safe and Sound, who will be joining us remotely, will share their findings and how their investments in research have really changed the lives of the children we serve. We'll begin with Suna.
Hello, my name is Suna. I come from Turkey, and it's a great honor to have this opportunity for me to speak at this event on behalf of AÇEV. AÇEV stands for Mother Child Education Foundation, and it is based in Istanbul, Turkey. And I'll be talking about our innovative and multi-sectoral approach to democratize the home environment and change social norms through father involvement. And we've been doing all this with the private sector. So for those who may not know AÇEV, let me give you a quick briefing. So since 1993, AÇEV's mission has been to make a lasting contribution to society through the development of children and their environments. And we do all this through education. And we develop evidence-based intervention programs for young children and their families in Turkey, as well as in 14 countries since 1993. All our programs have the common goals of reducing disparities and addressing inequalities. So, for example, outside of Turkey, one of these countries is Lebanon, where AÇEV's programs have been serving preschool-age children and their mothers living in refugee camps in Beirut. And Yale University in the US has been conducting an impact evaluation on the program and has showed proven positive impact on children and mothers. Similarly, right now, currently, with a Gates Foundation grant, our parenting program is being implemented in Brazil as part of a big research study. So today I'll be talking about our fatherhood work in relation to fighting against violence against children. So we believe it is highly critical to develop involved and responsible fatherhood to lower gender-based violence at home. So for this reason, since 1996, we've been implementing our father support program. And just a few years ago, it was recognized as a best practice program by the United Nations Women Agency, UN Women. Father support program, what is it and what does it do? It's a primary prevention strategy that targets men to combat traditional gender norms and empowers men as active fathers. It's all about targeting fathers who have children between the ages of 3 to 11 and is implemented over a course of 14 weeks. Each session is on a topic related to child development, effective communication, empathy, conflict resolution, and it's all about moving fathers towards behavior change. Sessions are held weekly, and they're about 2.5-hour-long meetings where about 15 fathers convene together. So the model of working together with a group of fathers has proved highly effective in promoting behavior and attitude change in our context. Now, why are we doing this? Let's again remember, we see fatherhood as a space for recreation of gender roles. So a change in the direction of a more equitable household, democratizing the home environment, in other words. So our journey for strengthening fatherhood skills is now evolving into a societal discussion of gender equality. While doing this, in our journey, we realized 3 very important things. Fatherhood, we can't talk about fatherhood in a vacuum. Fatherhood and masculinities are closely interrelated, and they intersect in multiple ways. So each one of it is very essential for the other one. And we see fatherhood as an entry point into transforming masculinities, and this has proved to be, again, very effective and resourceful method in Turkey's given context. 2, we realized we can't really only talk about training fathers to impact fatherhood and child development. We need to talk about facilitating a broader and long-term shift in fathers' attitudes on equal parenting. We have to advocate, and in fact, we need to create advocates of change. Otherwise, program impact cannot be sustainable. And 3, we need to talk about a normative shift in the society beyond programs and policies. So we need a strategy, because the challenge of underlying gender norms is of long-term work. So in that respect, as Nicole mentioned, to understand the state of fatherhood in Turkey, we carried out a research study. We had to understand what are the promoting factors and what are the risk factors for involved fatherhood, so that once we can understand that, then we can talk about impacting the legislative frameworks, the structural work conditions, cultural work codes, and etc. So once we launched and disseminated the State of the Fathers report, together with the Bernard Van Leer Foundation's support, the results were very informing and, in fact, alarming. And when you have the research results, when you're advocating, then you're able to bring the agenda to the forefront of the public conscious. And the research results really provided a key evidence for advocating for involved fatherhood. So we were able to approach our stakeholders with the study and to show them that there are some very important findings in the country. And if they want to take charge of this, they need to understand all the barriers for greater paternal involvement. So we realized we really have to support our education programs through a collective action. Through parenting programs, you're impacting the family environment, yes. But you also need to collaborate with other partners to be able to impact the other spheres around the family. And I won't be able to give the exact number for the US, but let me give you an example, the number for Turkey. There are about 10 million men working in the private sector in Turkey. This constitutes about 53% of the workforce. And most of these men are fathers. So we took on the pressing need to inform the private sector about the changes they can make in the workplace, required to promote involved fatherhood. And what we did was we actually brought in the high-level representatives from these private sector companies, some companies that you really know from the US, some big names. And all this was done, obviously, by UNFPA, the United Nations Population Fund support. And I will end my presentation here. Basically, very briefly, what we did was we've been holding workshops with them so that we can reach fathers from all parts of the society. We can mobilize the private sector because they're a huge important actor in reconstructing certain messages and values. If they're an advertisement company, if they're what kind of work conditions they have. And just a quick example, in our research study, we found that only 29% of the fathers in Turkey were able to use the paternity leave. And I'm talking about a paternity leave, nothing compared to the Swedish one. It's literally 3 to 4 days. And 21% said they had no idea that they had paternity leave. Another 28% said they knew about it, but their employers were not allowing them to use it. So something as simple as this was actually very instrumental in approaching the private sector. This is a very simple, example that might strike an idea. So let me close my words here. Thank you.
Well, so Suna, thank you for sharing your findings with us. You mentioned the work of involving the private sector. So how are you able to engage and mobilize the private sector to see the importance of supporting your programs?
So once they understood what are the demographics, and you can find the research report in English on our website. Let me, in the meantime, open up the website. We asked the companies, we said, what role can you play for promoting involved fatherhood? So we said, together we came up with a manual, basically, and there's some very easy to understand, difficult and long-term work to be done. We said, how can you advocate for paternal leave? Maybe you can consider providing childcare services at your company. If, like I said, if you're producing certain products, then be mindful of the messages you give in your services and products. Still, very big toy companies in their toys are, in the guidebook, you'll see the mother playing with the child. We said, how can you review your policies for work conditions? And now we're working closely with companies, sort of giving them guidance and consultancy so that they can move towards being a equal parenting friendly company. So these are just a few examples.
Thank you so much. Katie wanted to join us in person. Unfortunately, Winter Storm Toby made that impossible, so she is joining us from San Francisco.
Thank you so much. I just wish that I could be with you today. And I'm so grateful to Nicole and to World Childhood Foundation as well as Mount Sinai for including me in today's remarks. I'm going to share my screen in a few seconds, and hopefully technology works in our favor as well. But for introductions, I'm Katie Albright, as Nicole said, the Executive Director of Safe and Sound. We are a children's advocacy organization in San Francisco working to strengthen families and end child abuse. So with that, let me share my screen. We've heard a lot, and I've actually been following on Twitter the work that has been shared today. And we have heard a lot about the data regarding the impact of child maltreatment on the individual child, the individual family. I wanted to share with you some work that we're doing in San Francisco regarding the impact of abuse on a community and what that community look could really, that data could really help us all in driving action to doing what this ultimately, we're here today, is ending violence against children. As you may know, in 2012, the Center for Disease Control released a report researching the lifetime total estimated financial costs associated with just 1 year of confirmed child abuse in America. The report was based on 2008 data, and given where we are in our economy now, as well as in San Francisco, our very high cost of living similar to New York City, we wanted to determine what was that economic burden for San Francisco in current numbers. We partnered with Berkeley's Haas School of Business in doing our research, and we released our findings that I'll share with you today in 2017. Now we are, this year and next, expanding our research from San Francisco, doing a wonderful partnership with the state of California, and we'll look at the state of California and its economic costs, which I'll share, as well as all of its 58 counties. We couldn't have done this work without incredible partnership with several foundations in the Greater Bay Area and California area, as well as the state of California. So as I said, we took a community level look at what the cost of child abuse is, and we measured, as I'll share, 5 cost categories about what the impact is to the child. Child welfare costs, costs associated with special education, criminal justice, healthcare costs, and loss of productivity. We conducted what's called an incidence-based analysis based on 2015 data, which is what we had available to us at that point in San Francisco. And I'll start with a little bit of the methodology. Since the cost of abuses doesn't happen in a single year, you have to really look at the data in different ways, either on a single year called a prevalency-based analysis or an incidence-based analysis. Our work, again, was the incidence-based analysis, and I'll share why. A prevalence-based analysis provides an estimated cost of direct and indirect costs that were incurred in a given period, resulting from all current or prior cases of child maltreatment, regardless of when that maltreatment occurred. The second way to conduct an analysis is through an incidence-based approach. And I know this is technical, but it's important to understand that in this analysis, we're looking at the total lifetime cost resulting from an individual case of child maltreatment that occurs over a given time period. In this place, if a child was hurt in 2015, what are the overall lifetime costs associated that that child will potentially experience? This method, and the reason why we picked it, is because it captures the potential economic benefit to a community if all cases of abuse were prevented in that year. And that's what we're really all about, is what is the benefit of preventing child abuse? And what we found in San Francisco with our partners at Haas School of Business in Berkeley was that the total cost for a single case of child abuse, this is a non-fatal case of child abuse, and I know this is numbers and it's hard to hear, and we have to remember the people behind the stories, but what we found in San Francisco was that in the lifetime cost of a single case was over $400,000. The cost related to child welfare, bringing a child into protective services, special education that a child may need if they were a victim of child abuse, associated costs of criminal justice, whether or not it be juvenile justice or adult incarceration, healthcare costs. And I know we've heard today about the long-term impact of healthcare associated with the incidences of child abuse, as well as lifetime loss of economic productivity. And then what we did in San Francisco is we looked at what is that lifetime cost for the individual, and we multiplied it to understand what the impact is for an entire community. In San Francisco, and these numbers may be quite small considering I'm talking to a New York audience, but in San Francisco we had 753 substantiated cases of abuse in 2015. That means that Child Protective Services verified that this was an actual case of abuse. And you can see that in that very conservative number, just looking at cases that we know something has happened to that child and has been verified, that we have over a $300 million cost in that year alone. But we know, and research suggests, and experts say that substantiated cases doesn't really measure the true cost of child abuse. So we looked also at what were the number of reported cases, how many people, either mandated reporters or community partners or community members, were calling Child Protective Services in a single year and reporting an incidence of child abuse. And those numbers ended up with a cost estimate of $2.2 billion. And yet we even know that that number is relatively conservative because the cost of child abuse, because of so many unreported and unknown cases. And so we looked at what the estimated cost would be, and we looked particularly at the estimated numbers that Professor Finkelhor, who Dr. Finkelhor, who you heard from today, estimated in terms of what those associated numbers of true rate of child abuse would be. In San Francisco, 11.5% is where those numbers come out, and so for a total estimated cost of potentially $5.6 billion. And that number is almost so hard to imagine. So let me go back to that $300 million. That same number, $300 million, if we prevented all those cases of child abuse in San Francisco alone, we could send more than 300 3,000 children to college. And so that really underscores the reason why we're focused on prevention and what we could yield as a community if we focused on that. So, and I'll end in just two more slides. We wanted so this cost data was incredibly important for us to understand what the social costs were in San Francisco, but we also wanted to understand what were the risks associated that our community was engaging in that could impact and lead to child abuse, and how could we mitigate it? And so we did a lot of analysis around what were our high-risk activities, and this is again work from Haas School of Berkeley based on the Center for Disease Control analysis. And you see from this slide that San Francisco, like many urban and rural communities, but urban communities have significant risk factors that lead to child abuse as a whole. And finally, I'll end, Nicole, on a hopeful note, which is communities also, and you heard about the work in Turkey, communities also have significant protective factors. And here's where the data can really be used to make positive change for communities and for families and children. Communities have positive parenting programs, economic supports, they provide safe and stable housing, and invest in healthcare and social service education and parks and recreation. All of those things together, particularly put in terms of a community action plan, can really move us forward in terms of ending child abuse. And so that's how we use the data in San Francisco to drive change. And now I will end my presentation and come back to you live.
Welcome back. Thank you, Katie. So based on your findings, what are the next steps for Safe and Sound to expand the report? And then following that question, do we need more investment in research, or is it based on a lack of funding? Or with research like that, do you think funding will be amplified to continue your work?
Thank you so much for the question. As I said, we started in San Francisco. We released our report last year. We will be partnering with the state of California, and over the next 3 years, we will be publishing findings in our 10 Bay Area counties. It's the equivalent of Los Angeles County and maybe the New York boroughs, doing an analysis of what the cost is to each of the 10 counties in our individual Bay Area region. And then we're going to be launching to all 58 counties in California. California, importantly, being the largest state, I think this research will have broad impact in terms of our movement forward. In terms of your question around the partnership between research and funders and how to really drive change, I really think that there is sort of 4 essential partners, probably more, but let me talk about 4 in terms of driving change forward. You certainly have the researchers. You have the funders and the philanthropic community, as well as government funders. And then you have practitioners and policymakers. And each of those 4 intersect in an important way to drive change. Your question specifically was focused on funders and researchers, which has both incredible voice to drive change. Funders in terms of a significant ability to see broadly, see into the future, and connect different sources. Partners on the ground, so to speak. You have this bird's eye view, so to speak, in terms of moving issues forward. Researchers as a partner can go deep and understand an issue, and together researchers and funders are able to have a significant catalytic power to drive change. You're amplifiers, you provide credibility, and you provide an important drive forward, strategic drive forward to make change. And I think partnering with policymakers and practitioners creates this wonderful way of, in any area, but certainly in child abuse prevention, our ability to drive forward. And I'll end just by saying that we did our cost report to provide a tool to the community. Starting locally may have a broader impact, maybe at a national or global level, but we did it to not just focus on and understand what the cost is to a community, but more importantly, to understand that we have to invest in prevention and what is the social return on investment in terms of doing that, and what are those opportunities that we can do as a community. And I'll end here in terms of how do we end adversity against children. And I think this is one more tool in the practitioners and the policymakers and the funders and the researchers' toolbox in order to be able to do that. So I'm thrilled to be able to share with you. Thank you so much.
Thank you. And now Meg Gardinier, the Secretary General of Child Fund Alliance, will share her findings.
When you look at the Child Rights Convention, which was mentioned earlier, it's a paradigm that talks about children's rights under 4 areas. The first is survival, the second is development, the third is protection, and the fourth is participation. And within that paradigm, I think we've seen remarkable success. We've got a long way to go. But in the last 30 years, and it has been almost 30 years since that UN treaty was adopted by the UN General Assembly in 1989, we have seen progress on child survival. We've seen progress on child development, which is largely education. And again, I'm talking about progress that has been funded. When it comes to child protection, which is really what we're talking about today, on ending violence against children, addressing mental health needs of populations, these issues are so tough to compartmentalize in such a way that you can really demonstrate that singular streams of funding will make an impact, because it's so cross-sectional, so it's a real challenge. And when we look at the final P on participation, this is really the final frontier for us, is how do you engage young people meaningfully as agents of change, using their voice and their agency to speak up for what they know is right. And at the end of my presentation, if I have a few extra minutes, I'll tell you a little bit about a global project we're just launching to do just that. Okay. So that's who we are working. I failed to mention that we work with, in addition to working in 60 countries, our work helps more than 14 million children and their families. So we're very pleased with that amount of work, but we are, in all honesty, amongst the child-focused agencies with whom we work, World Vision, SAVE, SOS Children's Villages, Terre des Hommes, we're a little bit smaller, but again, our focus is really to differentiate on the ending violence piece. Again, I know that you had this morning. This is from a book that UNICEF produced several years ago on 6 strategies to end violence against children. And you see two images here. One on my right is a normal brain of a 3-year-old child, and the one on my left is the brain of a 3-year-old child who's experienced extreme neglect. And as I think you've heard today, violence against very young children results in long-term exposure to toxic stress and is known to inhibit optimal brain development. And the irreversible impact on the young developing brain can lead to a failure to thrive among affected children, and then poor performance once the child enters the educational system. So you have heard this today. You know this from your own work. I find that visual representation really moves policymakers in ways that sometimes facts and figures and stats don't. So again, that is from the 6 strategies to end violence against children, a UNICEF publication that's online if you ever need yet another visual, another tool to make your case. The economic cost of violence against children can be broadly divided into 2 kinds, direct and indirect. The direct causes are healthcare systems incur costs in treating the short and long-term physical impact of the injuries caused by violence against children. Healthcare systems also incur costs as a result of treating the psychological and behavior problems among adults that arise from the experience of violence in childhood. Social welfare systems incur costs in monitoring, preventing, protecting, and responding to violence, and then criminal justice systems incur costs in ensuring that perpetrators are so-called punished and real or potential victims are protected. So again, I know you've heard a lot of this today, the direct and then the indirect. The indirect is a little harder sometimes to point to, and it raises about, or it focuses on costs that arise from the impact in the most longer term. The most significant indirect costs are productivity losses arising from the ways that violence can impede child development. Adults, as we know, who are exposed to violence in childhood have lower levels of education, employment, earnings, and fewer assets. In 2014, I came on board in Child Fund in 2015, but in 2014, my predecessor, Andrew Johnson, commissioned a report with the Overseas Development Institute called The Costs and Economic Impact of Violence Against Children. And here is just a visual. We have the report online at our website, childfundalliance.org. It can also be Googled easily. The cost of physical, psychological, and sexual violence against children can be as high as US $7 trillion, 8% of the world's gross domestic product. Again, that figure was between 2 and 7% and 8%. We usually use that figure of US $7 trillion to make a case. I thought that was really high until Jeffrey Sachs told us a few minutes ago that the 2,200 people have a combined net income of, I think he said, 9 trillion. But anyway, we can grasp our heads around these numbers now. The annual cost of hazardous forms of child labor can be as high as US $97 billion, and the annual cost of children associated with armed conflict or armed forces groups can be as high as $114 million. Again, just trying to make the case to policymakers, to UN agencies about the economic costs of inaction, trying to put dollar figures on these using a particular model. The Overseas Development Institute looked at the global numbers of children who suffered violence in a given year, and using previous research on the cost of violence against children in some high and middle income countries calculated these global costs. And again, more about that method is available in a report if you choose to take a look at it. And follow-up, one of the things that we learned from this report was that that prevention pays, but we needed to understand how do we get to that point where we make the case to policymakers at the national, the global, and the regional level that we need to invest in violence prevention. So a year ago, the agencies I mentioned earlier, Save the Children, SOS, UNICEF, World Vision, along with the End Violence Against Children Coalition, the New Global Partnership, and I think Howard was here earlier and spoke with you, we all embarked on a study called Review of Official Development Assistance to End Violence Against Children. I think most of you here know what we mean by official development assistance, but just in case, it's the measure of international aid defined by the Development Assistance Committee of the Organization for Economic Cooperation. It's the principal measure that's used in most aid targets and assessments of aid performance. So we wanted to find out, how do programs attempting to prevent or address violence against children fare in this larger ODA framework. In the 107 recipient countries of ODA for ending violence against children, the average investment per child is around US 65 cents a year. And again, we had very carefully delineated how we would define violence, and of course we are looking for projects that directly impact, or funding that directly impacts violence against children. Again, figures are very, very low. Our main recommendation from that was that ODA donors should systematically track what is being spent on ending violence against children, and that's our next study, again with those same organizations. We find that it's really strength in numbers to talk to governments. A lot of us like to go alone to ensure our own branding and our own standing in the community, which is terrific. But we have learned that now we really have to band together at the partner level. In the past, some of our organizations that I mentioned, we were competing for the same dollars in North American markets, and now we've realized we've got to put some of this aside and really join forces to make a more effective case to governments for better investments. So that's one of the things that we're working on here. Child Fund Alliance, that's our website. Do I have any more minutes left, Nicole? I have 2 minutes. So I'm going to tell you really quickly about something very exciting for us. Last year, we launched as part of our implementation of Goal 16.2 to end violence against children, which many people mentioned today, including Jeffrey Sachs. We launched a project called ChildFriendly Accountability. It's working with young people ages 13 and to 17 in the countries where we're operative to hold governments accountable for better child protection systems. We've developed a methodology on analysis, assessment, and action. We pilot tested it in 4 countries: Vietnam, Paraguay, India, and Mexico. As we speak, it's being launched in Uganda, the Philippines, Mexico, Paraguay, Nepal, and El Salvador this year. Okay, very exciting times. It's great because we're starting to hear from young people about what this means to them. What does it mean to sit down and understand the laws and policies in your own area, to meet with policymakers to address gaps, to develop recommendations? This is kind of a new moment in global development. A couple of weeks ago, we had the chance to speak with a UN High Commissioner for Human Rights, and she said, you know, voice and agency and participation is going to be the game changer. Voice, agency, and participation among young people will be the key game changer in the next decade. And in fact, that's what we're doing. We're working with young people to equip them with knowledges and skills. You know, it was an interesting moment about 2 years ago. We brought together 11 of our members in San Francisco to talk a little bit about developing this project. We outlined the methodology. We were there for a day and a half, and it's really interesting. On the second night, a few people broke away and said, hey, I don't think we can do this. Hey, I think it's too much. Are young people really going to be able to tackle this? So we brought their concerns back into the larger group the next day, and people overwhelmingly said, young people can do this. And this is what we've learned. Young people in Vietnam, in Mexico, and Paraguay have already told us that this project has done a lot for them. One woman said from Vietnam, ChildFriendly Accountability helps me to know about child rights and child protection. It helps me to understand more about myself. I like meeting with friends the most. I like working in projects. Another young person, a 13-year-old 8th grader, the Dong Pong Junior High School in Vietnam, said, 3 months with the ChildFriendly Accountability Project has changed me. I've learned more about communication skills and participated in brand new activities that I've never been aware of. They've made me feel comfortable. I myself am an introverted person. I never participated in any school actions, and I was worried when given a presentation or a task working in a group. But when I was encouraged by the facilitator, I felt confident and I felt proud. And you know, we've had lots of testimonies here about the impact on young people, and we hear from teachers that they see the children having more confidence and that they're more proactive. They find the gaps in the existing child protection system, says a parent, and they try to address them. I'm very proud. I'm so surprised, said one teacher. My young people have so many skills, especially communication skills, that they confidently delivered a presentation in front of a crowd on a corporal punishment issue in our community. So we're starting to see that, you know, that we have to look at young people not just as passive agents of change, you know, beneficiaries, but also equip them with skills to really move forward and, like all of us, hold stakeholders more accountable. So that's probably it.
That's
With my
it.
2 minutes.
Thank
Okay,
you so much.
Thank you so much for bringing youth voices into this room. We always talk about children, but they are never present. But at the same time, it's very hard. How do you find them, and how do you engage them, and how do you sustain that engagement? Because they are children during a very short period of time.
Child Fund, like many organizations, works through local partners. So in Uganda, they're working through 3 local partners to identify children in an area where child protection issues are very acute. Child Fund trains the facilitators. They do the outreach with the local ministries, and they identify young people in the schools. Each of our programs works a little differently, but basically we have trained facilitators that work with local partners, that work in consultation with schools and government ministries to identify young people in school and young people out of school. How do you sustain it? This is really interesting. I was in Paraguay a year and a half ago, and we met with the Minister of Education, and he said, I would really like to implement this into our program, you know, into the Ministry of Education. If you can show us, if you can pilot test this and show us that it works, you know, I take a good look at incorporating it. And that's what we mean by scaling up, is, you know, eventually turning it over into systems. In Mexico, Child Fund Alliance there, or Child Fund there, ran the pilot project. It was 3 months. They were very pleased with it. They're integrating it into their entire program. So they're going to make it a permanent feature of all of their work, you know, which is very challenging, I think, because it's yet another layer, I think, of work that needs to be done and funding that needs to be identified. In India, what's really interesting for me is that our Child Fund office there, again working with global local ministries, have instituted this in villages where they claim that they'll impact 10,000 children. They've taken this concept and they've sort of integrated it with local leaders. So every place has to do it differently. But I agree with Joanna. It's one thing to pilot test. It's one thing to say, hey, this is great. It's another thing to keep it sustainable. But as you all know, success breeds success. If young people take this and they own it and they can make the case and they can mentor younger people and they can speak to policymakers, I think we stand a chance to see this survive beyond the classic eight-month intervention.
Thank you to both of our panelists.